Tonight at 11, some breaking news in the coronavirus outbreak as a second person now tests positive for the virus here in Rhode Island. The health department making this announcement just hours after confirming the first presumptive case of coronavirus here. Health officials say the new patient is a teenager. She is at home with mild symptoms. As we reported earlier, a man in his 40s was the first presumptive positive. He is hospitalized tonight. And a woman, I should say, in her 30s is also being tested. The health department says all three of these people were on the same trip to Europe in mid-February. That trip organized by St. Raphael Academy in Pawtucket. The teen and the man are both members of the St. Ray's community. In response, the school will now be closed for the week. Students will take their classes online. The group of 38 students and chaperones who were also on that recent trip to Europe will self-quarantine for the next 2 weeks. Health officials will monitor them. Meanwhile, the Achievement First Academy in Providence will also be closed tomorrow and Tuesday. That's because the woman who's being tested for the virus is a staff member there. Today, we also heard from the city of East Providence, their mayor meeting with school officials and leaders of the police and fire departments to discuss their response to the arrival of the coronavirus here. This after Governor Gina Raimondo and state health leaders held a news conference this afternoon to inform the public of the threat in the Ocean State. Eyewitness News reporter Kate Walsh was at that press conference. She joins us now with what we're learning about the first confirmed case.
We discovered what we believe is the first case of coronavirus here in the state of Rhode Island.
It was only a matter of time, and now Rhode Island health leaders say their own labs tested a presumptive positive case of coronavirus Saturday. A man in his 40s is being treated at an undisclosed hospital. At a news conference Sunday, the Department of Health said the man came back from a trip to Italy, Spain, and France last Saturday, February 22nd.
Fortunately, this person had very limited travel in Rhode Island after returning from Europe. The patient had not returned to work after coming back from their trip.
Director Dr. Nicole Alexander Scott says that patient's family self-quarantined once he started showing symptoms.
At this point, no one else who lived in this person's home has developed any symptoms. That is a critical factor.
But she said the man did have interactions with others, an estimated 40 people who they're now contacting.
These additional contacts are being asked to self-quarantine for a period of 14 days from their last potential exposure to this individual. That means not going to work, not going to school, and staying home.
The Department of Health is teaching these people how to monitor for symptoms. They'll also have public health nurses checking in on them several times a day. This case is called presumptive positive because the positive result came back through Rhode Island health labs, not those from the Centers for Disease Control yet.
This is the same process that every state is using throughout the country. Because this is a new test that we are all using on a novel virus, we are running the same test that the CDC is again repeating. And that's the protocol that they have asked for, and that's what we are doing.
Dr. Alexander Scott said the state tested the sample here to expedite the process so they could put their response plan into action as soon as possible. We're told the Centers for Disease Control is also working right now to contact people who were on the plane with this man as they arrived back to the U.S. from Europe. In the control room, I'm Kate Walsh, Eyewitness News.